If you're taking any antibiotic or any anti-infective agent like Flagyl, for example, is very bad with alcohol. It decreases the effectiveness. Antidepressants, along with alcohol, lose their effect and make you less drowsy. If you're taking insulin or any of the oral diabetic drugs, anti-diabetic drugs, alcohol can drop your sugar to dangerous levels. Don't have a drink within hours of taking these drugs. If you take antihistamines, you know, antihistamines most of them make you tired anyway. If you take alcohol in association with them, they'll make you very, very tired. They may make you dizzy, very hazardous to drive. If you take most of the medications you take for blood pressure, particularly in association with alcohol, can drop your pressure so that you faint and feel dizzy. I can go on, but if I had more screens, but the fact is,
well, you got an over-the-counter one there, even Tylenol.
Yes, insulin we talked about. Warfarin is a very important one. That's a blood thinner. If you are on warfarin and you take alcohol, you may end up bleeding. Your blood will be too thin.
That is no way to spend New Year's.
Aspirin, for example, we know that a lot of people take aspirin regularly, or NSAIDs, get the irritation of the stomach and get bleeding. If you take alcohol in addition to that, you increase that risk too. Even Tylenol, which doesn't give you gastrointestinal bleeding, but acts on the liver in association with substantial amounts of alcohol, can cause liver damage.
But doctor, can I ask you, before you go out, sometimes people will say, oh, here, take a couple of aspirin, because if you do have a glass of wine or two, you might need it for a headache the next day. So you're saying don't even do that?
That's absolutely the wrong advice. And thank goodness for this network, because it's the only one that gives you that good advice. So the bottom line is this: if you're on any drugs, don't take alcohol at the same time or within 2 or 3 hours.
All right. Good advice, of course, for New
Club
Year's.
soda.
Well, yeah, basically. Do you wear contact lenses? Well, you know, it's cold and flu seasons. Dr. Rosenfeld says it could be time to consider glasses. Why is that, Doc?
You know, I'm not an ophthalmologist, and I was really surprised to read this report recently. A lot of people wear contact lenses during the day. They take them out, of course, during the night. But when you get a respiratory infection, a viral infection, your whole body is involved. And that sometimes affects tear production. Very often in a bad cold or the flu, your eyes become dry. You can develop pink eye. You can develop infections in the cornea and so on. So it's better to take the contact lenses out. The cornea swells when you get flu, and the contact lenses can irritate the eyes if you have a respiratory infection. I'm told that is so by my ophthalmological colleagues. So it's not just everybody has an extra pair of glasses. Wear them when you're coughing and sniffing.
Great suggestion. Well, we are starting a new feature here for you, and it's called Myth Busting, because Dr. Rosenfeld, as you said, we give the most accurate health information here on the Fox News Channel. Here's an inaugural myth, and it's quite surprising, actually. The question, Dr. Rosenfeld, is spinach, in fact, a great source of iron? Okay,
I want to amplify on your introduction. I think this is a good... We're going to start with myths for the program and end with Healthy Mondays. I want my viewers to send in questions about if you believe certain things and are not sure medically that they're true. Send them in and I'll discuss them. Now, spinach, ever since Popeye appeared on the scene in 1929 with his muscles and so on, and ate all these spinach and leafy green vegetables are generally associated with iron. Spinach is the exception. It's because spinach does contain iron. It does contain iron, but that iron is not absorbed. That's because spinach also contains a chemical called oxalate, which, when it binds with the iron, is not absorbed. So the iron in spinach doesn't do you any good.
For a number of ailments, and a viewer was wondering, doctor, if it works for hot flashes.
I got to tell you, I don't know what to make of this acupuncture business. In 1977, I was invited to China, and I witnessed an open heart procedure in which the patient was wide awake, and the only anesthesia was acupuncture.
Wow.
At that time, I was convinced that acupuncture is extremely effective. And I have to tell you, in my own practice, I often recommend it for patients with low back pain. About 25 or 30% react to it or respond to it. Now, what I want to talk about is a recent study. You know, women, menopausal women have hot flashes. Women who've had breast cancer taking certain drugs like tamoxifen develop severe hot flashes. So there was an experiment in which there was a trial in which they gave some of these women acupuncture, and then they gave an equal number. They stuck them with needles, but not at the acupuncture site. They put in the needle and just withdrew it. So this was in fact sham acupuncture. At the end of the day, or the end of the study, they found that the women who got the sham acupuncture responded, had fewer flashes, and the same amount as the people with acupuncture who received the real acupuncture. So why does a sham needle help as much as the real acupuncture? I don't know the answer to that. It's postulated that this is the placebo effect. You know, if I tell a patient and give them a blank pill and say, this pill will make you feel better, because of their confidence in me, there's some hormone, there's some substances released in the brain called the placebo effect, which make them feel better. I don't know what the mechanism is. So my advice is this: if you're listening to this and have hot flashes, and it has been recommended that you take acupuncture, I would do it. I don't know what the mechanism is. All I know is that it can't harm you. If it helps, that's fine. And don't bother trying to figure out the mechanism. It has not been figured out. Sure that the pool area is well ventilated.
And if it's not, then have second thoughts, I guess.
Yeah, if it's not, wait till the summertime.
Okay. There's a prescription.
Exactly. All right, well, many people are going to the doctor and they're getting these full body scans these days. When we come back, doctor, well, before you get it done, it sounds pretty easy and it sounds like it would be informative. That's probably why full body scans are becoming so popular, even among people who don't need them, but they're full of risks that can be avoided, so says Dr. Rosenfeld. Who knew?
I tell you, I'm very glad to have the opportunity to discuss this. There are many private centers advertising people to come and get total body scans. Everything, it's the greatest diagnostic thing. It's because doctors don't spend enough time with patients examining them, listening to them. All they do now is they put them into a machine and that'll give you the answer. It doesn't give you the answer. There are several things. First of all, they're expensive. It raises the cost of health care in this country, which is already formidable. Secondly, the CT body scans have an enormous amount of radiation. The incidence of cancer will increase if these CT scans become used in asymptomatic people. So here is my advice. If you have a symptom or a finding on physical exam that needs further evaluation. For example, if you've been a heavy smoker and the doctor is worried that you may have a small cancer which is not picked up on a routine x-ray and recommends a CT scan of the lungs, that's fine. If you have some abdominal symptoms that worry the doctor and they want to take a CT scan to look for a specific thing, that's fine. But if you're feeling well, don't have any risk factors, don't have any family history of what it is they're looking for, I don't advise these CT scans. One other reason, we don't have a lot of experience with these scans. A lot of the things that they reveal are probably normal. There are many people who undergo unnecessary biopsies and intervention because the CT scan has shown something that may be significant. There's been a tremendous number of these false positive findings. So, and I want to remind you of one thing. One CT scan of the chest gives you as much radiation as 150 regular x-rays. So that's what to bear in mind. And if you take a total body CT scan for no reason other than screening when nothing is suspected, it's dangerous, and it's foolish.
Wow.